Thank you, Mr. Chairman. I'd like to focus the panel for a moment on the self-employed, which Mr. Ahrensmeyer talked about a little bit in his testimony. Again, you told the story about Louise Hardaway, who couldn't find insurance or was quoted $13,000 a month. This is, I just want to ask you just to confirm what I think is true and actually know is true, that her situation is not created by government, by government option programs, or by mandates. I mean, in fact, the self-employed right now are completely exposed to the marketplace with absolutely no protection under prior HIPAA laws, and in most states, virtually no regulatory protection. I mean, that group needs help. Isn't that correct, Mr. Ahrensmeyer?
Absolutely. And it's a growing part of our economy, 21 million now and growing. It's a critical part of our 21st century high-tech economy. And you're absolutely right. I mean, the system couldn't work worse for any group than it's working for them. And it's directly impeding our economic growth.
And I'm trying to, Mr. Speranza, to sort of decipher where the Chamber is on this issue. I mean, you sort of, at the end of your statement, talked about the Chamber thinks it's time to reform insurance markets, but you sort of danced around the question about making the folks in that end of the market participate or not. I mean, I guess the question I want to ask you is, does the Chamber support or does it not support an individual mandate?
I would say that we would certainly consider that. Again, as I said, I'm not an accountant.
So, I mean, but wait a minute. I mean, you're here representing the Chamber as someone speaking on health insurance.
Yeah.
I mean, I come from Connecticut, and we're surrounded by insurance companies. And when you talk about reforming the market, their response always is, fine, but you have to have an individual mandate, because otherwise you're basically creating a system of adverse selection, and rates are just going to go through the roof. And the Chamber is smart enough and experienced enough to understand that dilemma. And really, I think this committee and the people of this country, and frankly, your members, of which I was one of them up until about 2 years ago, deserve an answer. I mean, in terms of where the Chamber stands on this issue.
I can't make policy for the Chamber they represent.
Well, I would ask that the Chamber come back to this.
I would say is, sir, I would ask from my discussion with the healthcare experts, it's something that, as I understand, they would seriously consider.
Well,
and personally, I would as well.
I frankly think the issue's been out there for years, and the Chamber has enough staff and experience in this issue, and frankly has enough members who are directly impacted by it that they deserve an answer, and we need to understand that as we go forward over the next 6 weeks or so.
What I would promise is getting an answer back from staff on that point.
Mr. Acker, in your testimony, I mean, I noticed you were very clear about supporting an employer mandate. There was sort of an absence of comment in terms of the individual mandate. I was just wondering if you wanted to chime in.
No, in my original proposal, Healthcare for America, there is indeed an individual mandate. All I would say is that I think that it's essential that you have both an employer and an individual requirement, that there be a real emphasis on the affordability of coverage if you do have an individual requirement. My main concern is always how do you ensure that people get enrolled? And an individual requirement without strong measures to ensure enrollment will not work. And I think this is particularly true with populations like the self-employed that I think would benefit the most of any employment group in many ways from having the choice of plans within an exchange. So what I would say, and this is not in the legislation, is if there is a tax penalty associated with failure to provide insurance, that at the same time that that penalty is assessed, or before it's assessed, people should be given the menu of options within the exchange and given the option to enroll in coverage within the exchange. I think that's exactly the kind of constructive step that is being proposed in a lot of other areas. Try to give people these choices, make sure that when possible that people are opting out rather than opting in, automatic enrollment. And I think if we did that, we would move towards a system of seamless coverage that would get us very close to covering all Americans and achieving the Congressman Kucinich's goal of health care as a human right.
And Mr. Ahrensmeyer, I mean, again, your members, I mean, again, they go through the experience of applying for insurance as a self-employed. Again, the risk takers, the capitalists who want to go out and pursue their dream, but if they have an old sports injury or a cesarean or chronic illness, they get shut out either with outrageous premiums or or denial of coverage completely. And for them, I mean, we've got to fix this. And if we really care about the market and a capitalist system, these are the people that we have got to create a path to health insurance coverage. Isn't that correct, Mr. Ahrensmeyer?
Exactly, and there's tax inequality too. The 15.3% self-employment tax that a self-employed person can't deduct the way a business owner can deduct. I mean, if you think about this country, which prides itself on entrepreneurism, the healthcare system does nothing but put impediments in the way of going out on your own, striking out, taking risks. And also, if you look at traditionally pulling out of recessions in the past, it's the small business sector that leads the way out of the recession. And usually at some point in time, the small business sector is creating 100% of the net new jobs as we're moving out of recession. So it's completely crazy. We've heard a lot of talk today about the private sector and competition, but we don't have a system that's got the kind of competition we need. We don't have a system that encourages competition among businesses. And it's precisely this type of approach that the committee's put forward that's going to enhance the ability for everyone in the system to compete, and ultimately the businesses out there who are building products and providing services to allow them to compete.
Thank you, Mr. Chairman.